welcome to the UN Brief. I'm your host, Maya Plentz. Today, the World Health Organization has warned countries on the lifting of measures to preventing the spread of Omicron. Dr. Tedros reminded all that a cautious approach was needed. Vaccines will continue to prevent severe disease, and research and development is ongoing to catch up with the virus mutations. Dr. Maria van Kerkhove, who's lead epidemiologist, also warned of being led to believe that because we have vaccines, at least in the North Hemisphere, we should let go of other measures for prevention of transmission. Dr. Mike Ryan, Director at the Emergency Response at the WHO, also reminded countries that they should not be copying each other, but looking at the evidence, as well as making sure that if they are lifting measures too quickly, they should be ready to reinstate them as rapidly. Thank you for watching the UN Brief, and don't forget to subscribe.
Since Omicron was first identified just 10 weeks ago, almost 90 million cases have been reported to WHO, more than were reported in the whole of 2020. We're concerned that a narrative has taken hold in some countries that because of vaccines and because of Omicron's high transmissibility and lower severity, preventing transmission is no longer possible and no longer necessary. Nothing could be further from the truth. It's premature for any country either to surrender or to declare victory. This virus is dangerous, and it continues to evolve before our very eyes. WHO is currently tracking 4 sublineages of the Omicron variant of concern, including BA.2. This virus will continue to evolve, which is why we call on countries to continue testing, surveillance, and sequencing. We can't fight this virus if we don't know what it's doing. And we must continue to work to ensure all people have access to vaccines. At the same time, it's also clear that as this virus evolves, so vaccines may need to evolve. Variants of SARS-CoV-2 may continue to escape neutralizing antibodies induced by vaccines against prior variants. Today, WHO published a new report on the burden of medical waste from the pandemic, threatening human and environmental health and exposing the need to improve waste management. Health workers and members of the public rely on huge amounts of personal protective equipment, tests, chemicals, syringes, needles, and other disposable products to protect ourselves and others. But after we have used it, most of it ends up as waste. 30% of health facilities globally and 60% in the least developed countries are not equipped to handle existing medical waste loads, let alone the additional COVID-19 load. This potentially exposes health workers to needle stick injuries, burns, infection, and affects communities living near poorly managed landfills and waste disposal sites.
Countries have not gone through the peak of Omicron yet. Many countries have low levels of vaccination coverage with very vulnerable individuals within their populations. And so now is not the time to lift everything all at once. We have always urged caution in applying interventions as well as lifting those interventions in a steady and in a slow way, piece by piece.
every country has to find its feet, know where it is, know where it wants to go, and chart its path. You can look to the experience of others, you can look at what other countries are doing, but please don't just follow blindly what every other country is doing. Chart your own path, as Maria said, based on your current epidemiology, your demographics, your population at risk, your vaccination levels, your population immunity, your access to tools, the strength of your health service. And each country can chart a path out of the pandemic by taking that approach. I think it's a transition phase for many countries, not every country in the same situation. Those countries who are making decisions to open up more broadly also need to be sure they have the capacity to reintroduce measures with community acceptance quickly if needed. So as if you open the doors quickly, you better be pretty well able to close it fairly quickly as well. And therefore it's important that we keep communities informed and maybe ensure that communities understand that measures may have to be reintroduced.
Thank you for watching the UN Brief, and don't forget to subscribe here below, to your right or to your left. Thank you for watching and listening or watching the UN Brief. I'm your host, Maya Plentz.